sometimes hospitals are selling your data. If you go to the hospital, they will be using your data for at least 3 months to enrich or to,
Yeah, your point.
Welcome to Interchain Me, hosted by Roberto Capodieci, where we bridge the worlds of new and old technologies, meet extraordinary individuals, revisit visions of the future, and celebrate the connections between technology and life. You're now listening to New Tech.
Does not compute. Does not compute.
Hello everybody and welcome to another episode of Interchain Me. We have today a guest that I love to discuss with because the topic is very, very much of my interest. Is Fabrice Kwetchet, and I'm sorry for your family name I didn't pronounce correctly. And he has a nice project for medical records on the blockchain, which to me is one of the best use cases. He has a company which is called Ulalo, which we learned that in Swahili means bridges to connect the different parts, which is very good. So we introduce to you Fabrice. Thank you, Fabrice, for being in the show with us.
Thank you very much, Roberto. It's a great pleasure for having me. I'm indeed the founder and CEO of Ulalo, a company that really breaks my heart. That's just building something is a passion. And I really love to do that with blockchain, and having to talk to a legend like you is a real pleasure. Thank you.
Thank you for your nice words. And yes, you've been working with Microsoft, right? With large corporation implementing software. So you're one of those people that come from large corporates and then move into being a founder, which is a very interesting aspect. I saw many succeeding very, very well, and many going, oh my God, because it's a very different lifestyle, the one of the founder of the small company compared to the one of being employed in a large corporation. So, congratulations for crossing the bridge. This is, again, the Ulalo between the large corporation and the founder, and for the fantastic use case. Where are you from? Where do you live? You're based in Belgium, right?
Yes. Well, I used to live in many countries, many continents.
All right.
I'm originally from Cameroon. I left Africa when I was 18. I went to France. I had my computer engineering degree in Lyon in France. That was it. And I work in different countries based from there. So I'm a French citizen living in Brussels. And we use also to live in the States, where I was doing a PhD back in 2008. So that's me.
Okay, wow, it was quite impressive, I have to say, And I know there is this huge, again, bridge between Africa and France. Like France owes so much to Africa. Actually, they're still taking one. There is a lot of a situation there. But right is the entry port in Europe for a lot of people from there because of the language, because of the past political situation. And so good that you cross this bridge as well. And also good for your accomplishments, which are quite impressive. I've been in the US as well, but I had not been lucky to do PhD other things. I'm a drop-off from kindergarten, so my school is very limited. But we end up in the same place. So blockchain, right? What is, a description for people listening to us of the scope, the goal, and why it is choice for Ulalo?
Yeah, first of all, I think you don't have a success without a succession. You mentioned that I work for different corporations globally, having good pay, making my life for my family, like everyone does, right? But at some point of time, you get to a point where you ask yourself, what am I leaving behind with all those that I have? And I wanted always to help the world. I found myself going to a hospital with my 1-year boy, not knowing how to, breathe because he swallowed a screw. And I was in an emergency running, fasting, and praying that, he just survived. The doctor managed to save my son's life, and after that there were a lot of issues with connecting the data between the insurance and I asked the doctor in the hospital, why in the world 21st century you guys are not connected? You guys, I have the same question coming over and over. Emotionally, I'm not ready to start discussing those things. You have everything to make that happen. They said, no, we are all in same, infrastructure. Our connections is still in the old ways, sending papers or email over. And I thought myself, why in the world we are not using decentralized architecture to make those happen in a fast way?
Right.
And by the way, that day I also had an car accident, because I was driving too fast going to the hospital. Solving those claim issues between my brokers, my careers, and the one of the other cars was also the same mess. So we start thinking about building something based on blockchain that can simplify and streamline those processes. And I found myself, I'm very lucky that I can go quickly to the hospital and save my son's life. What about the other people in the world? What about the 80% of the world not having a close doctor? And Ulalo is really meant first to help people across the world who are owning their patient record. But we found that there is also, in this specific era, a lot of LLM that are very trained for medical record that can enhance those kind of diagnoses. So you are now able from your phone to have access to the kind of knowledge that we were not even have access before. So
All right, so
Ulalo
let me
is-
let me put a point here. Okay, so you are
Yeah.
hitting 3 points that I think that are very important. First, allowing different separate entities. I can even think if I'm traveling for holiday in another country, maybe, so I am far from where my paperwork is, so I can bring with me, because of the blockchain documentation wherever is needed, and let people access it. Second is owning and controlling my information as well, because many times those papers stay with the medical institution, and I cannot access them when I need, example, for the insurance, which is even something separated, right? And three, consider that all those documentation related to me are in one place. I can use particularly train AI to even warn me that I may go toward the particular situation. Obviously, people need to go check this thing with the actual doctors after that. But
Exactly.
a good warning that can make people aware that between all those information, which probably originally will be split between 10 different hospitals, 10 different doctors, so nobody has a global view to say, I can understand this because I can see all the documentation, because they are scattered around. In this way, you can have an intelligence on the health situation of a person, which people has personally, and extract the potential issues or potential warning things that would not happen. So those are three important things, I believe, also, because we all know the medical information are sold for value, like
Yes.
hospital monetize. And if I want to sell my information, at least I can make money myself, I guess, right? If I want to do this, right?
Exactly. You hit really the point of what we're doing here, and I really appreciate that. The fact that your medical data are scattered, let's help the doctor that you're going to meet. You're a traveler, or you're going maybe for vacation in the States or in Australia, and all of a sudden you need to go to an hospital, but the guy doesn't have a complete history, or even sometimes in the same country you go, because this medical institution has your neurologic data and this other one. So this problem has been, tackled in different way, on a different angle, usually from an institution angle. So you have a country setting into place what we call a medical record patient to centralize those, but that institution is somehow managing it. We believe that your health data is like your identity. You should own it, right?
But only, I think that there are so many privacy laws, mostly in Europe, where, to protect citizens, sometimes they create troubles. I remember as soon as we had this new government entity for privacy in Italy, if a friend has an accident, you want to go visit them at the hospital, at the reception, they cannot even tell you what room was this person in, right? So in the moment that, in order of comply with the law, medical institutions are not even allowed to share this information, where it can be vital to survive when you had an accident in a completely different location. The fact that I can control my own information because they are also or just with me, allow me to authorize whoever I wanted to access them, right?
Exactly.
And, at least it's strange because if I go to buy a car, I pay the money for the car and I leave the dealer with my own car, right? But
Yeah.
many other institutions, I pay for the service and they keep the result of the services. So all the
Exactly.
documentation stay with them, which is the what I paid for, or what, as in many countries, health is granted to all the citizens, is my right to have because it's something about me. So I understand that the hospital want to keep a copy, but at least give me a full detailed copy, x-rays and other things that most of the time they are just reluctant to give to people. So I like the idea that that's my information. By right, I have the right to have it with me. I can authorize you to keep a copy, but it's my choice. And I
Exactly.
can handle it and manage it as I wanted through a system like a blockchain, a decentralized ledger, which is fantastic. On the
Completely
technical
agree.
aspect, right, in a technical aspect, how you manage to structure something like this that require large quantity of data to be managed as well. I know you choose the Avalanche layer
Yes.
one solution. What is the approach technically for the part of the audience that is more technical savvy on the subject?
Yeah, I think we had indeed a lot of technicalities, a lot of choices to make in terms of data governance, data privacy, because we need to build like a permission network where you are able to have access to your data, but not everyone in the network even knowing what are the transactions that are made from this wallet towards the network. So we choose Avalanche first because of the fact that we can create those subnets, and on Avalanche we can build in those subnets either a private or permission blockchain tailored with the needs of healthcare, which are obviously very importantly should be secure. We have that in heart. And the quality of data. So we start having an hybrid blockchain approach where we say, okay, when the users from his device scan or import data, we encrypt it from his device before storing it on the server. So we extract using OCR features what are the key metrics that will allow him to classify those documents in his application, but we are not sending to the servers or any kind of data that can be recognizable, if I can say that like this. This dual infrastructure where we say, okay, the heavy data, the blocks data are stored encrypted on IPFS with a key that's only accessible by the patient, by the users, help us to have something that is not only scalable, but fast in a way that we proceed with those data. So
I mean, that makes sense. What is the particular future? Because I'm sure somebody else thought about this solution. Like I saw a lot of attempt to do something like this. So what makes Ulalo stand up? What particular feature you have that can make it like the solution of choice for the industry?
Yeah, so there are basically three things that we wanted to give people that stand out. So first of all, we want it to be gas-free for the users. So all
So
their
there is no
transaction.
need to go find the currency, whatever, etc., etc. I use my application without having to bother about this thing. I don't even know that there is a blockchain behind.
Exactly. So that's the first thing. We want people to don't even think about how is it a Web3 or not application. So the second thing that we build it for is to allow the people working with it having the impression that this project is owned by them. So the way for the monetizing of their consentment, you mentioned a very good thing. Sometimes hospitals and institutions are selling your data. I was in a conference here in Europe where, they will say we need to fight for the predictive medicine battle that is going all over the world now. And the only way we can do that is having data from patients.
Right.
We will be now having this little checkbox where it is kind of opt out by default or opt in by default, yes. So meaning that if you go to the hospital, you're stressed, you're pressed, you're not reading all those, they will be using your data for at least 3 months.
Right.
To enrich or to,
Yeah, you point out very good things because when you are there with an emergency, you're not gonna start reading all the small prints, all the small things. You just sign whatever, and without realizing, you're giving away your informations. Absolutely.
Exactly. And this is a gold mine. This next big thing is gold mine. So you have many huge institutions who are working only in collecting those data for oncology, for any kind of medical issue to improve the model, to prepare the next generation of medical services.
Sadly, also for marketing reason, for the pharmaceutical company to approach people with, or the relative doctor in the area with the correct medication, etc.
Yeah, exactly. So what we're doing is we say to the people, we are building an anonymized way to assault your consentment and get rewarded. So if you want to improve the medical research or be part of a trials program for the pharmaceutical, if show you how your data that will share with them will be anonymized, pseudonymized, you will be able to agree or not. Okay, I agree, but I get this money for this period of time. We're discussing with our regulatory advisor because in Europe it should be during a certain period of time. You cannot just give for life. Yes. So that I think it would be very important for people who sometimes just need an extra money. They have this goal in them, right? So this is a way to improve our platform that also make a difference from what we've seen so far. But we think also that we are in an age where we've seen open source model that's been trained on millions of records, patient records, which are very performant. With some images, you can upload your XHR or any kind of imagery on some blockchain, which are able to detect cancer cells 5 years prior
before a human
life.
can.
Yeah.
Absolutely, no, that's for sure an interesting aspect. I saw how Grok was advertised at a certain point, the Elon Musk AI to say where this was one of the points that were say you can upload medical record, X-rays and things, and Grok is gonna give you an opinion on those for sure. And the fact that there are open source model or a model that can be installed locally, maybe particularly trained to do these things, also protect privacy to an higher level in terms of not sharing this with ChatGPT, OpenAI or large company or meta. Right. So how was the implementation? So where are you with these things? I know that it's being implemented. There is a testnet that is starting soon. How are you doing in the implementation of things?
I have to say that we've struggled a lot. There has been a lot of trials and error, but we managed to find a team that is able to execute. We've been able to have our first MVP that has been tried out. We are improving it. We built our testnet on Avalanche, as we were saying, and the launch is meant to be this week on Tuesday. We will have a webinar on that.
For those listening to this later, is the 8th of June, today that we're recording, so probably in the first half of June 2020, we are giving the incipit, at least in the testnet, to Ulalo, right?
Yes, indeed. Thank you. Yeah, and that's what we want. We want the developers, we want the early users, node runners, everyone who can, say, hey guys, this will need to be tackled differently, because we build it for for users. We're not any kind of huge company with other interests in mind.
All right, so let me just get here to this point is quite important. So as the testnet rolls out, which means is a sort of a private development of a blockchain. So it's a special blockchain just to do this, okay? I would say that the testnet is going to be more open to allow people to test, right, to try. So you will need beta testers, users that want to see how the system work, try to connect, maybe with pretend names, not the real names or whatever, but try to upload the documents in order to help you shape up things properly before you go with the official launch of the system, and at the same time for people to understand the potentiality, how they can integrate. So I think this is a call to system integrators that work with medical machinery or medical systems in order to see how data can be then sent to this network, to a specific user, to potential patients or doctors that want to see how this can be used on the other side to retrieve and do work with it. Correct? What other kind of people you need for your testnet?
We also need people from the Web3 space, the crypto space, because we've launched a token also with that to maintain the network, to maintain the security. So we provide swapping, and with the AVAX, we have bridges with different kind of token. Where we want people to test those. We have a faucet also, so bring people in our community, because in 6 weeks times we got approved on Maxi, so we will also launch list our token to the public. So that's the idea.
Okay. So, all right, this is quite interesting. So, which is the user interface that the average, again, doctor or patient is going to use in order to interact with the system? You have like a mobile or iPad or tablet kind of software, or is a web interface? How does
So we went basically as a mobile first application. So we built it for Android and iPhone. So basically we providing those two interfaces because we didn't want to start integrating with Web2 platforms. So we want users to constantly upload their records and test the product before, starting looking for partnerships with, global institutions. So that's basically where we start.
Okay. So you also have an API set for integration with other systems, or is gonna be bridged by humans?
So for here, as our company is based in Europe, they told us to start with manual bridging. So the user upload the document or take a photo, they generate the PDF behind. So all our OCR systems are running, but we have the full consentment of the user who's uploading the document.
So how can people approach you for any sort of things? I think there could be journalists that are interested to write about your solution, because it's for sure something of interest. People that want to try, like doctors or hospitals want to try to see how to integrate or talk to you, how they will be able to reach out to you.
Yeah, so we have different communities. So if they go to ulalox.xyz, they will find everything on that. So we have our LinkedIn, it's our Telegram community. So we are posting like every day. We have a lot of returns. They can reach us. We will be more than happy to have a quick chat with them. So thank you for reminding us. It's very important.
Yeah, that's important, because else it remains just a token finish on itself. So it's important that there is a consequence to this. I love that blockchain went under a period of super spotlight, but it was so connected to ICO scams, etc., etc. And as the global attention shifted towards artificial intelligence, then is finally the moment for real blockchain project to come to place, right? Because at least there is no more this connection with, all this ugly aspect that unfortunately touches most of the, emerging technology. AI itself with the deep fake is not being exempt from, but it has a different kind of reputation. Myself, we tried to do an interesting project that included NFTs. Or as soon as we mentioned blockchain NFTs, this is a scam, like this. We had to manage everything with a central server. So it is rightfully the good moment to bring to the people the advantages of a decentralized system, I believe. And after all, if you were not, if blockchain wasn't a part of the solution, what will you do? It means to have a data center where people need to trust you in order to collect and store their data. And, and then we are at the same starting point. Then why not just leaving it with the hospital, etc., right? So,
yes,
I do believe that not only is a practical solution to allow the controlled sharing of the information by the person owning the information, which is the most important thing. But it also goes around a lot of regulations in a very nice way, because nobody can tell me where I cannot share my information. A regulator can tell a third party how to protect the information that belongs to somebody else. So limiting this third party from giving this information to others or making it available in a certain manner. But when it's my own information, honestly, the regulator cannot tell me that I cannot give it to somebody, right? Because it is my information, so I give it to the person I want. And this is one thing that either you go through a decentralized mechanism to do this, or you cannot do it, right? Because it's always going to be in somebody else's hands unless it's stored physically in your cell phone, and then it becomes another sort of issue, like you lose your phone and you lose your medical record, which will be silly. So blockchain, one more time, provides the opportunity to achieve some amazing things that otherwise wouldn't be possible to achieve, right? And it goes down to being able to control your own data, which is you possess, because we are on the age of information, and information is the commodity, right? That's what is worth money. They say is the oil of today, is the way that social media makes money. Is free to use, but they actually profile you, sell your information around, etc., etc. So if this is the case, and we are worth a lot of money because we keep producing information as we are alive in many directions, is a fundamental right to control where this information goes. If it's monetized, to at least have a chunk of the money that is generated out of it. I don't say everything, which would be fantastic, but at least a chunk of it. And being able to know who this information goes to. Because once it's me deciding, I know exactly who. If you think about the solution that is, because people sometimes don't understand the difference in data management when it goes in a centralized or decentralized manner. When you are in possess of your information, there is much less replication of information. For example, if I register for a new cell phone, I register for other things, a bank account, etc., my home address is saved in each of these institutions, right? Phone company 1, phone company 2, bank 1, bank 2. And if I change address, I need to tell to each of these institutions that I changed address, right?
Yes.
Using a system like blockchain to give access to my address to all these people, I change it only once. And if they're authorized to see my address, automatically all of them are updated with the new address, even if I forgot about them. And if I don't have any more a contract with the phone operator number 2, I can say update everybody, but not phone operator 2, which is no more in right to see my new address. And they start talking me about getting bills paid, which I don't want to pay, for example. But the idea is this. I control my information. I let who I want to have it. I don't need to repeat the same things 10 times. I can repeat it only one time. Same goes for your solution. If I'm in a holiday on the other side of the world, I have an accident, I have something, and a medical record is added there. This can be a good use for my doctor back in my country to give me a diagnosis on something that can happen at the point. Rather to have them to comply with the law that they cannot share it somewhere, give it to me and I lose it on a piece of paper, etc., etc. So there is way more than just, for sure, we are way above the fancy use of word blockchain just because it makes people sell things. Because I had a client, a prospect client that came to me, tried to add blockchain to things that made no sense whatsoever to have a blockchain in, right? But it was a selling marketing word. So now we are at the point where it's the real technology that makes the real difference and allow things to be done that otherwise we cannot do. Many people that are scared of the word blockchain, I always say, is a technology. You cannot blame technology for the scam that people made using it, right? And it's unfortunate that there is this tainted, sometimes thinking about, it's blockchain, it's crypto, it's scam. Like databases are used to make a fantastic website that are saving lives, and databases are used also to do things to people. There is all the spectrum of uses of a technology. So blockchain is no different. It's a technology, doesn't have a brain to think, to do bad or good things. It's just the application of it. In the case like Ulalo, for sure, is a fantastic use case that makes sense and can achieve things that otherwise would not be possible to achieve. So the blockchain is the solution for it. It's not being pushed in because it's a fancy word. It's not being because otherwise you cannot do this thing. And for sure is also finally after 10 plus years the pioneering of actual practical blockchain solution. There is not just the token for the penguins or whatever, but it's a real use case.
Yeah, I completely agree, Roberto. Myself being working in the Web2 sector for almost 20 years, I would have, easily used all the knowledge that I've gathered in terms of database systems, working where everything needs to be bring all together in a center place, having maybe this place where becoming a bottleneck, and as you said, trying to refresh all the satellite system, not knowing who has access, who has some of my payers data. It's the words you've been working on so far has been very, very, straightforward build for those institutions who can use your data and do whatever they want with them. This main goal was for this couple of people that are institutions that were managing it and enriching themselves on your behalf, on our behalf. So what I love with blockchain, you highlighted very intelligently, is that we're giving back the control to the real people. And we are in this era of design where people want to know more, want to know where their data is, by whom it's being used, and we would do everything to have that. We have an amazing technology that is getting better and better at every cycle, and combined with AI, And we're seeing things that we were not expecting even last year. So I'm very,
Right.
very surprised and amazed.
Yeah, there is the AI component. There is also some mind-blowing aspect of things. It is for sure. It is a good marriage between AI and blockchain. I will say, blockchain is really the infrastructure. So is really the backbones. Is like the pillars that keep things, like functioning in a way that is important. AI is really like a blob. It's something malleable, I think, that sit on top of things, right? And gives this an incredible plus that I think it was no AI. Your project will be fantastic anyway, but to make sense of all the data collected, you will need to have somebody with an extreme horizontal knowledge in medicine, because you can go from one point to the completely different point of health, things from mental health to a broken bone to an infection, like they are so variegated, and start going through things that make sense and find connection by the organized in a timeline, which comes first, which comes later, organized by geographical location. You were in a tropical area with a certain disease rather than not. It would be a very big job that a good trained AI model can do in a short time and with much more precision, right? Obviously, the last word should be always trained human, but a trained human that has a report prepared by an AI will help him make sense of all the things, what documents are related to what findings. So what is called in AI a RAG, which is an AI that is able to collect information from a document storage, which will be all the medical record of a person. And in an anonymized format, can also give warning about things happening in certain area of the world. There is a certain sickness is expanding somewhere rather than not. If a user allow the use of the data to be, anonymized and used for certain other kind of research. So that's pretty powerful. And I think it is a combination of blockchain, which guarantee the quality and security of data in terms of what is shared, how, and all the cryptography behind it means that the piece of information can be shared in this portion to who, etc., etc. I remember doing a project with blockchain like almost a decade ago, where hospitals, there was a single document that was encrypted in each field. It was a form. Each field was encrypted with different keys. So when this document circulated inside the same, it was for hospital, in fact, the administration will see the financial things, but not the medical aspect of it. And the doctors see the medical things, but not the financial aspect of it. So there is no influencing in how to deal with the client based on how much he's spending or what he's sick about, and keeping the privacy even inside a single document, separated between the different parties that will deal with the document, which is an important aspect also of blockchain. The regular communication are in a single starting and a single ending point. For example, if I send an email to somebody and that this person forward my email to somebody else, they're not really forwarding my email. They're sending a copy of my email to somebody else, which can be tempered, changed, or whatever. In the world of blockchain, if I send a message to somebody, I'm actually creating a message in the blockchain and sending these people a link to go see the message in the blockchain. If this person forward my message to somebody else, they're just sending to somebody else a link and the decryption key if you want to see the same things that I created, I signed, and is certified that is mine. So this is important to understand when it comes to medical record. We are not creating a copy of the medical record that is given to somebody else. It is the original one, created by whoever made it and cryptographically signed by whoever made it. That is encrypted with some keys. And then somebody can access it. They are actually going to the original one, signed and created at a precise point in time by somebody. They're not reaching a copy that can be tampered with, it can be put in another moment in time, etc., etc. Blockchain is one, if not the only things that can create timestamping with quite no microsecond precision. But if I have an X-ray, there is timestamped inside the block, and blocks are created every minute, just to say, is going to belong to that point in time. So I cannot use the same X-ray to pretend I have an accident 1 year later, for example. And those are very important characteristics of a blockchain that when applied to medical record and management record are important to be understood by people, because people may think it's just a document management system that sends replica of documents around. It's absolutely not that. Everybody will have access to the original one, cryptographically signed by the person that made it, which is a very important aspect when it comes to medical record.
Definitely, completely agree. And even when you share those anonymized documents with an institution, you monetize those access, those disposable, but you also track who has access to it and when, and you can remove these access at a moment of time based on the contract that has been signed and for which you've been doing work. You mentioned very important things. Is that you're traveling, you're going somewhere. Oh, you want another advice or consultation for a doctor across the globe for telemedicine, kind of access. You just do it in a matter of one click. You gave access to a list of records you want that are classified in your medical data hub, which is, by the way, here is on blockchain. And that's very, very interesting. The fact that you're not dealing anymore with copies, but with, links. And when you think about also all the discussion about, storing and duplicating data, and the impact of emails exchange in the world now is just huge in terms of electrical consumption, data centers, and people often say that blockchain is even bad at the ecological impact. I would say no. If you're seeing what you just explained, and this is very important to note that we are sending references, links, instead of copying files.
Absolutely, there is less traffic, better quality of data. Yeah, it is such a pity, and has been something that made me in a way suffer in the years, that this technology that has such a powerful impact was used only for cryptocurrencies, which honestly is not something that fascinated me. The first paper I wrote in 2014 was about documentation flow for trade finance. So it was really where there is a fantastic impact of blockchain, there is outside the cryptos world, which is already too much used. So here we are in something that is something that I like personally. That's the point. So I am, I evangelize and explain decentralization, and I don't use blockchain exactly because of this issue of the name. Decentralizing system that are not financial, monetary, crypto. I understand that people is very attracted to money. Yes. I like the quote from the movie Idiocracy. I like money. Oh, me too. We should hang out together. Blockchain is much more than that. And can make the life of people much more safe and secure by using each of the single component that it has to exist. This is why I'm very happy to support as much as I can a project like yours, because this is what really brings blockchain to the correct use cases and to the people for something that is important, like health, right? And then what is true, the user shouldn't even know that behind there is blockchain. The user should just use it and have a fantastic use out of it, right? Explaining the technology is the extra bit that I like to do, because I would love other people to be inspired by this and come out with other projects that are also functioning in these terms, but for other industries, for other things, because it's important to understand it. But ultimately, if you sit in a car, you need to know how to turn it on and accelerate and go ahead. How the engine works is for the mechanics, is not for the person driving the car. And this will be the case also for any solution implemented. So people shouldn't even be scared about technology. I don't know how it works, I don't know how to use, because at the end, when you operate it, you don't need to know how it works. fill in your field, press the button, and the checkboxes that you need, and you're using the product. But it's a beautiful thing to sometimes understand how underneath, behind the scene, things are implemented. But it shouldn't be something that scares people from saying, I would like to approach a project, but I don't because I don't understand the technology. No, absolutely not. Understand the goal of the project. If it resonates with you, then make it a thing to contact Fabrice and ask how I can help or what can be done to make the project grow faster or become maybe between people listening to this there is a director of an hospital, maybe an hospital there is an avant-garde that they are investing in R&D, they're investing in new solution. Have a chat. You never know. Maybe there is something good that can come out with Fabrice. So yes, I think we've been covering a lot, all the aspects. There is something else I forgot, I missed?
I think we covered a lot of things, Roberto. I'm very thankful for that. We didn't mention the security because there are a lot of frauds in data access in different medical sectors. But for us, it's obvious that the blockchain is hyper secure with different consensus mechanisms where you have sometimes to trade a centralization for high speed, high throughput. But we have found with Avalanche consensus mechanisms that's based basically on a smaller set that are of validator that make things going faster. So and we're not trading the security for high speed. We just want to say that we have the best interest of patients in our heart. And we want to work with you guys. The testnet is there for you to try to see our codes, to see, guys, you need to maybe change things. And we definitely open to have new forces coming on, new tech guys, new marketing guys, new people in the medical sector who can bring more ideas. We're open to all of that. Thank you very much.
Fantastic. So, I think thank you for being with us. Maybe we check back in a few months to see how the process is progressing, and we're gonna get some tangible feedbacks of an application on blockchain that is making a difference. Thank you everybody for watching. Stay tuned for more interesting conversation on new emerging technologies.
You've been listening to Interchain Me, hosted by Roberto Capodieci. If you're not subscribed, you better smash that subscribe button now, or else your smart fridge might just stop being so smart.